Walk.me device, which I am wearing right now, which will be designed to help people with mobility and walking problems. All of you will be familiar with the main problem of gait impairment. Walking problems can lead to frequent falls, to injuries, to reduced autonomy, to general weakness. And this has a huge impact, not just on that person's health and well-being, but on their mental and social lives as well. Not just for themselves, but also for their carers and their loved ones. The concept, the phenomenon behind the Walk.me device is this thing called rhythmic auditory stimulation, which has been documented, studied, and researched in depth for many, many decades. And rhythmic auditory stimulation, what is it? When your favourite song from Earth, Wind & Fire came on the radio this morning, and you started tapping your hand, tapping your feet, that is rhythmic auditory stimulation. It's that link between sound and movement. There are two major pathways for coordination and movement. It's very simply put, in people with Parkinson's disease, the main pathway when a signal is sent from the brain to the body is damaged or impaired in one way or another. What we're doing with rhythmic auditory stimulation is to enable, if you will, an alternative pathway for that signal to go from the brain to the body. And so when we send out stimulation, that secondary pathway that's lit up in blue there comes into action, and that enables the user to regain his coordination and walk better. So what is our product? It's sitting right here on my waist. It's linked by a wire currently to these bone conduction headphones, which I'm wearing, which you see sit just in front of my ears on the hard bit of the skull. So the signal that's sent from this device to here goes through the inner ear. There's a little beeping sound. I can still hear everything that's going on around me, the bus behind me, my conversation with you, the radio, the TV, etc. We are specialised in the implementation of rhythmic auditory stimulation. Our device is patented, it's portable, as you can see, absolutely non-invasive. In this little film here, you see on the left one of our first users trying to get through a narrow space, and you see her on the right absolutely flying through that same space with the Walk.me device. I invite you to go onto our website because there's much more of that. Narrow space is not very difficult for people with Parkinson's, and you can see that without, she's had a great deal of difficulty. With, it's completely a much simpler thing for her.